Assalamualaikum and good day everyone. We meet again. This is our last chapter or subtopic under the chapter 1. The last topic will be anatomical terminology. Alright. Okay. So on this topic we will learn about the body position, body cavities and other terms that you should get familiarized before you continue to other chapters. Okay. Alright, so without further ado, first of all, anatomical position. Anatomical position is actually is defined, right? This is the definition. It's an erect body, which is you stand up, upward, and your palm facing forward like this. Okay, erect body, feet slightly apart, palm is facing forward, and thumb points away from the body. Okay, away like this. Right, this is the position of anatomical position. This is how we define it. Right, then let's go for our body parts. Okay, we categorize them in, we can have I would say that a few classifications. What we call as trunks, right, is from our thorax up to our pelvis. Our cephalic, which is our head area. Upper limbs, okay, referring to from axillaries up to our digital fingers. Okay, sorry, this part up to here, and then our lower limbs. Okay, from the pelvic area, sorry, from the hips until to digital toes. Okay, digital fingers for the upper limb and digital toes is for the lower limbs. Right, so here bear in mind, please note that the names in parentheses are the common names. Okay, this is the common name. Okay, you can have finger, wrist, and this is the name for it, but the official one we use like otic, cervical, axillary, acromial, brachial, and so on. All right, the one that we have parentheses that you should follow. Okay, so the directional terms. So we have a direction for each our anatomical position. We call it as superior, okay, toward the top. Okay, anything in front toward the top is superior, inferior toward the bottoms, verter, everything in front. Okay, everything in front. If you remember the anatomical position, everything that facing us, that time is what we call as ventral, and posterior, everything at the back. Okay, dorsal. Medial, lateral, superficial is toward the surface of the body, internal away from the body surface, proximal toward our trunks, while distal away from our trunk. This is a few terms that we have to remember along the way when we are learning about human body and anatomy, right? This is even for the animal also, especially for the word of ventral and dorsal, but for this part we will focus on human body. Okay, so to give you a clear pictures regarding this, we make it the comparison superior versus inferior. Okay, upper, lower, interior versus posterior, ventral is dorsal, medial versus lateral. Okay, proximals. Okay, remember this is proximal versus distal, superficial versus the deeps. Okay, superior, inferior. Okay, this is the region. Okay, it is true that we need to take some time to remember it. Okay, but bear in mind, there's something that you have to remember. We have midline. Okay, midline is a point where what is mean. I mean, like the direction for the medial and the lateral on our body part. Okay, this is the same things. Okay, inferior of our cranial. What does it mean? It means that toward the head end or upper part of a structure or the body above. Okay, look, it going upward, right? And then this is for the inferior. I would love to discuss about a medial. Alright, it's toward to our midline, to the center. Okay, Alright, lateral is away from the midline, and bear in mind we have intermediate, which is between a more medial and more distal structures in between. Okay, this is intermediate. Okay, which part of our organ they are more to intermediate and so on. Right. So in the body part, in our abdomen, we have right upper quadrant, we have left lower and right lower. Alright, we have right and left, up and lower quadrant. Okay, so this is the one that I mentioned before, regional abdomen area. Under right hypochondriac regions, what we do have here, a portion of our liver. While for epigastric region, mainly our gastric area here, and the livers, and so on. So this is the function of the division of the term in anatomical. Alright, and the center is our umbilical region, mainly our large intestine. Alright, by now I hope you really understand about that. Next we go to the body planes. Okay, this is actually an imaginary line that divides body into different sections. We have sagittal but not equal, which is our vertical plane and right and left parts. Mid sagittal, okay, median and equal, which is vertical plane and right and left half, while frontal, coronal, vertical plane, interior and posterior part, okay, and transverse, okay, something cut in between is a horizontal plane, which is to separate between superior and inferior part of our body. So this is the plane that we just discussed right now. Okay, this is the transverse. I said that it cut horizontal. Okay, median, mid sagittal plane between frontal, okay, from this side, okay, transverse, you can see from this area. Okay, this is the last part on this subtopic, is about body cavity. Okay, an empty, really not really the empty like body. Okay, body cavity area or space within our body. Okay, so we have body cavity. What we call here is cranial cavity, which is part of our dorsal body cavity, which is consists of cranial and vertebral. For your information, this is filled with our brain. This area, this cavity is filled with our neuron system. Alright, and second we have ventral body cavities, which is consists of thoracic cavities, which is your lung, your heart, okay, position in there, diaphragms, and abdominal cavities filled with our stomach, duodenum, small, large intestine, and so on. And lastly, pelvic cavity. Pelvic cavity different with male and female. For the male, we have for the female, we have a uterus position in here, right? This is part mainly for the both of male and female. This is our reproductive organ area. Okay, it's mainly situated here. Alright, so for your information, okay, all this membrane we have, all this area, most of the area we have aligned by serous membrane. They are periatrial, which is outer layer, and visceral, which is referring to inner area. Later we will go a little. I will show you to precisely where these membranes located. Okay, the body have two major cavity. The one that we saw just now, dorsal cavity and ventral cavity. Again, dorsal mainly for spinal and cranial, while ventral is for thoracic cavities. Okay, and our abdominal pelvic cavities. Okay, this is the serous membranes. It's showing you in the heart, in between our heart, between our myocardium, endocardium. This is endo, this is myocardium. Okay, this is pericardium, and this is the in between. Okay, visceral pericardium. Okay, this is lined by serous membrane in between pericardial and visceral. It is this region. Okay, lastly, about other cavities, what we call as a retroperitoneal organ. Okay, how to remember that? Okay, we have call it Seth Parker's, the organ that between our abdomen area, okay, which is our glands, urethra, duodenum, P for pancreas, U for uterus, C for colon, K for kidney, E for esophagus, and R for the rectum. Okay, this is the lower part on our body. Alright, that's it for this. I hope you enjoy it. If you have any issue or you like to ask, you can write it down in the system. Okay, and then the team will look into it to answer the question. Alright, that's all from me. Thank you for your time and thank you for your interest on this topic. Alright, Assalamualaikum and have a nice day.